We like to say. Yeah. All right, are we all good to go?
1 sec, just waiting for a microphone to power up.
Can we do a volume test, or
yeah, that'd be great. If you could.
we can just talk about the beautiful weather we're having today. Hope everyone's feeling nice and steamy. A little bit cooler, yeah.
All right.
All going all right?
Yep.
Everybody ready?
Great, thank you.
All right, good. Oh, good morning, good afternoon, everybody. Lovely to see you all here at Dandenong Plaza. Let me start by acknowledging the traditional owners of the lands on which we're gathering, and pay respects to elders past, present and emerging, and we're here, of course, in Boonwurrung country. So, just a quick update on the vaccination status of where we're going here at the Dandenong Plaza Vaccination Hub, one of the busiest hubs we've got on our network, and particularly with back to school now only a few days away, it's been really good to see over 1,000 5 to 11-year-old vaccinations being delivered through this centre over the last 11 days. 1,070 vaccinations done to children aged 5 to 11. We've got over 6,500 appointments available this weekend for children across the network to get their 5 to 11s done. So if you haven't yet booked in with your GP, if you haven't booked in yet with your pharmacy, you can come to one of 6,500 appointments across our 36 state clinics that will do your 5 to 11 appointments. And if that doesn't appeal, then you can walk up at a number of our sites. So 7 of our vaccination hubs are doing walk-ups now for 5 to 11s. You can come through here in Dandenong, do a bit of shopping and spin in with your youngster to get their vaccination done. So here at Dandenong Plaza, you can walk up and get your 5 to 11 at the Royal Exhibition Building, at Sunshine Hospital, at Sandown Racecourse, at the Campbellfield Old Ford Factory, Caroline Springs Leisure Centre, and at the old Bunnings in Melton. All of those sites will take children walking up 5 to 11s, not only this weekend but going forward. We're really keen to make it as easy as possible for parents to get their children vaccinated, of course, before school starts next week. And if, of course, you don't quite make that, then please make it a priority during the early days of term. We really want to make sure that happens. To further support children to get the vaccination, we're also running 15 school pop-ups this weekend. We've announced those previously. Full details are on our website, but they include Movell Primary in Kings Park, St Albans East Primary, Wyndham Vale Primary, Lilydale Primary, and right here in Dandenong North, Lindale Green Primary. So 15 schools in total are doing pop-ups this weekend. Again, if you're living in that area, if you want to get your child vaccinated there, of course it'll be a comfortable and familiar environment for them to do just that. In terms of the booster program, again, we continue to see good progress every day. More people, more Victorians getting their third booster. Just under 2 million Victorians aged over 18 have now had their third dose vaccines. That's 1.94 million. That's 37% of all those Victorians aged over 18. Particularly encouraging to see now over half of over 60s have had their booster dose, so 52%, and 62% of those aged over 70. But we've really encouraged people to come forward and get their booster done. 76,000 of us have got our booster appointments made for the next 7 days, but there are many, many more appointments available. And again, across primary care, across pharmacies, GPs, and of course our clinics, it is now very easy to get your booster dose. And certainly in our state clinics, less than 5 minute average waiting time. So you'll be in and out in under half an hour to get your booster dose. This is not something you need to take a whole day for. It can be done pretty quickly. Make an appointment or walk up. Just please, let's get it done. In terms of our case numbers today, sadly, there are 31 Victorians who passed away or are recorded as passed away in the last 24-hour reporting period. And of course, we send our thoughts and condolences to their loved ones as they deal with that at this difficult time. We have 953 Victorians in hospital with COVID. Those numbers are slightly down again on yesterday, and we're seeing a welcome slow reduction in those hospitalisation numbers. We have 114 people in intensive care, 39 of whom are on ventilators. And of course, we wish all those people recovering with COVID, whether you're in hospital or indeed at home, the very speedy and full recovery. In terms of cases today, again, another sort of steady number, 12,250 total cases reported today. Half of those on the rapid antigen testing reporting platform, just over 6,000. and 6,244 PCR results. Just a word again on PCR results. We've now seen 31,000 tests, 31,422 to be precise. 94% of those results coming back the next day. So we're back to having a fast system. Average waiting time on our network is now 8 minutes. You'll be in and out before you can finish a Golden Gate Time ice cream, in fact. So really, we would encourage people to come and keep that testing discipline going. And with over 2.2 million rapid antigen tests now distributed by the state through the network over the last couple of weeks, you can get your rapid antigen test at our state testing sites. If you've got symptoms or any concerns, you can get tested with either PCR or a rapid antigen test. So please, I'd be happier if we see, with 12,000 active cases, I'd rather see more testing numbers coming through every single day. As I said, in terms of rapid antigen testing, we're seeing growing availability not only through the state testing system, but also through some of our supermarkets and other retailers. And my thanks to the retail network for their proactivity in making sure that rapid antigen tests are coming through. We've now distributed over 2 million of those rapid antigen tests through our health services and our testing network. We're allocating another 8 million this week alone. So a really big step up in the number of rapid antigen tests going out through our services. 4.5 million of those 8 million are already with schools, ready for schools to open up on Monday. It's been great to see already, I think, parents picking up their rapid antigen tests from schools last week, so we can really start to see those tests coming into the network. And of course, from next week, we'll be asking all students and staff at primary, secondary and specialist schools to be doing their twice a week rapid antigen test as surveillance, to make sure we keep an eye on the level of COVID we'll see moving throughout the community. So great to see that real step up in rapid antigen testing, and my thanks to the schools in particular for their active work in getting ready for an exciting school year. All the additional measures they put in place in terms of the air filters, the special school plans, the sunshades, getting the classes outside, and of course putting the testing framework in place so that people can be as safe as we can possibly get them as we move into the start of a very important school year. Finally, before questions, we're pleased to continue our work on building on some really important community outreach work that we've been working on for really the last 2 years. And can I thank all those volunteers and voluntary organisations and charitable organisations that work with us day in, day out over many, many months. If I look at our vaccine champions, if I look at our rapid response community engagement teams across the entire state, we've got so many organisations really working 7 days a week to support their communities to be COVID safe, to get access to vaccination, to get access to testing, to do all the things that are helping us to look after people at this complex time. To support that even more, we are launching a community outreach program where there are grants of up to $20,000 available to small local voluntary organisations to help people with the COVID safe behaviours as we move forward. Whether this is around helping people access rapid antigen testing, whether it's about local education programs, getting people to testing sites, getting people to vaccination sites. If you've got an idea about how you can help your local community to fare better with COVID, then please apply to us. Details will be in the show release, and we will do what we can to support you to do the very important work you do on the ground. This is all about all of us, regardless of where we come from, regardless of what language we speak at home, regardless of what other additional barriers we might face in being COVID safe, to get as good access to information and support as we possibly can. With that, happy to take any questions. Yeah. I don't yet. I don't have that. Obviously, we've just started those school pop-ups, I think yesterday, so we'll put those numbers in the show release, but I'd expect the first results to come through probably tomorrow, certainly by Monday.
Do you have numbers on the number of 5 to 11-year-olds already vaccinated?
Yeah, so I'll put the updated number in the show release after. Don't have it to hand. I think we have we're getting to about 38% of 5 to 11s have now had their first dose. We'll confirm that number offline. Look, we have around 4 million Victorians in total who are eligible for their third dose vaccination. Just under 2 million of those have been done. So there are 2 million people who are now due for their booster dose, and that's why we stand up each day. We're very keen to encourage them to come forward and get their booster dose done. There are so many ways to get it done with GP, your local pharmacist, all these 40 odd state clinics. They're all there to help you get that done. Oh, look, I think there are. I think we, as always, we're going through a bit of an uncertain time. I think we're starting to adjust our thinking that, to be complete from a vaccine point of view, with an Omicron wave ahead of us, we now need to have 3 doses, not the 2 that we were working on in the last 6 months of last year. So unfortunately, the COVID pandemic continues to evolve, and we need to evolve with it. So if you're double vaxxed, then you're not as fully protected as you could be. If you're eligible for your third dose, you need to get it done now. Do I think that people would rather be doing other things? I'm sure many of us would. But unfortunately, this is an important way to protect yourself and to protect those people around you.
So during case numbers at school, reliance on community compliance to do testing at home and practice with hygiene, you confident that parents and kids are going to stick to that regime?
Yeah, look, absolutely. I think if you look at the way that, I mean, I think for all parents of school-aged children, they're desperate to ensure that our children can have an uninterrupted school year this year after the complexities and the challenges of the last 2 years. So I think we've worked really hard with schools and with school communities to put those basic things in place. So, good hand hygiene, social distancing where we can, the use of masks in school settings, the air purifiers, the moving the lessons and the changing the structure of lessons to be more outside, and of course surveillance testing. They're all elements of a toolkit. I think the vast majority of families will welcome those sensible measures because it helps them protect their children, protect their families. I think the surge of availability of rapid antigen tests in Victoria, with 6.5 million going to schools next week, will make a massive difference in terms of the level of community surveillance that we see. And we want kids who've got COVID to stay at home for 7 days so that their classmates can continue to learn and that those kids can then go back into school the following week.
We expect to see a spike in cases when kids go back.
Yeah, I think as I commented, I think on Wednesday, and as the Cho's commented, absolutely. Look, we would expect as we see people coming together again through the school environment, there will be more opportunities for community transmission, and with 12,500 cases being recorded today, with over 100,000 active in the community, we should expect to see more cases generated as people come back together again, whether it be at school or at work. The issue for us is putting all those additional measures in place where we manage that as effectively as we can and minimise the onward impact of that. Yeah. So look, we're obviously following the international developments on the BA2 subvariant of Omicron closely. Still very early days in terms of understanding exactly how that's moving around. I'm aware there's a very small number of cases that have been detected here in Victoria, and our clinical teams are working through with that. But at this point in time, this is an Omicron variant, so this is not, as far as our clinical teams are aware at the moment, this is not a new variant. It doesn't behave differently. It looks like a part of the Omicron variant that we're dealing with at the moment, but as more information comes in, we'll adjust our strategy if we need to. Literally a handful. Yeah, and again, look, we obviously identify those through the sequencing work that we do, particularly in our clinical settings. We're not screening every single Omicron case that we get, but as we see evidence of that, then obviously we'll be interested to see whether it behaves differently, whether it's different in terms of its infectivity, whether it's different in terms of how it responds to the vaccine. So it's very early days. Look, we're part of a national and international effort here where our public health teams are working very closely with their colleagues across Australia and internationally to get all this information in. And that's again what's different to the pandemic to where we were last year and the year before. We're all at the bleeding edge of this thing, so we're all discovering new things every day here in Australia, just as we do elsewhere in the world.
The timing of the blitz, obviously vaccines today become a couple of weeks to
Sure.
must be too late. Should it have happened earlier?
No. I think we've been blitzing on vaccines since the 4th of January. I mean, since the 10th of January when we really stepped it up, and we had the 5 to 11 vaccine was first available from memory, I think, from around the 14th, 15th of January. We've been going as hard as we possibly can all the way through. If you look at the work we've been doing around the specialised paediatric vaccination clinics, the work around the Enchanted Forest, the work to really create a strong and positive and welcoming environment for our children. We've been working this really hard all the way since the very start of January, as soon as that vaccine was available. But we'll continue to step it up. So with schools now being back open again, that gives us an opportunity to do some school pop-ups in places where there are not as many GPs, not as many of our state clinics, and we'll continue to evolve and respond to how we can encourage kids to get vaccinated over the weeks ahead.
Those 6 million rapid antigen
Yeah.
tests that are wage.
Yeah.
How long do you expect those to last, considering there are 2 tests required for
Yeah.
students?
So there are, so as I speak today, there are 4.5 million of those rapid antigen tests currently with schools, and I know schools started allocating them at the end of last week. It was really good to see. Certainly, people in my network who are parents already picking up their rapid antigen tests for their kids before schools even started. So 4.5 million with schools already for next week. There'll be another 2 million that are being distributed through the education teams over the coming days. So those 6.5 million tests will last for 2 weeks. And then in 2 weeks' time, there'll be another drop of another 6.5 million tests to all the primary, specialist and secondary schools to ensure that all their staff and students can start the second cycle of testing.
Do you expect any issues in preparing those tests in the future?
Not really, no. I think if you look at we've ordered over 200 million tests now across the Victorian government ordered 200 million tests in total. Those numbers are now starting to come through in a much more predictable fashion. So we received, I think, around 6-7 million tests last week. We're expecting to receive another 7 or 8 million tests this week. So the supply lines as we get into this are becoming a little bit more stable, and as the suppliers gear up their production. So there'll always be a few white knuckle moments as we wait for planes to arrive and move things around. But at the moment, we're feeling more confident that we've got good supply lines in place that allows us to get 6.5 million tests out to the school communities, and we'll repeat that program in a couple of weeks when this phase is over. Yeah, on average, we're handing out around 25,000 rapid antigen tests every day at our testing sites. And again, I'd encourage people to keep coming forward for testing. So it's good that we're seeing a greater level, I think, of community confidence around how to manage COVID in a much more open way than we've ever had to do before. People, I think, are more aware of their symptoms, more aware of the need to isolate at home with only a 7-day isolation period. Some of those things are not as onerous as once they were. But I would encourage people to keep coming forward for testing. We've got over 250 test sites across the state. They will all be offering PCR tests. They will also, some of them, about a third of them, are also providing rapid antigen tests out to people. So if you're not sure about your symptoms, if you're feeling I can't get hold of rapid antigen test, go to one of our testing sites. We will ensure you get access to testing. And right now, average wait time's 8 minutes, so it's pretty quicker than going into a shop. Yeah. Absolutely, we've got buckets of vaccine available for the booster program. That's why we've got all of our state clinics set up. That's why the GPs are working so hard. That's why the pharmacies are working so hard. And if I look at, again, the concern we had a couple of weeks ago was with when we saw those much higher case numbers in the community, we were concerned about staff availability with what, 6,000-7,000 healthcare staff furloughed. Those numbers have really come down now. So we've got around 2,500 healthcare staff furloughed. That's still a significant number, but we've got more headroom now to manage the level of activity that we need to do. So this is a point in time which we have an opportunity to get that important vaccination job done. Obviously we'll wait to see what National Cabinet decides in the coming weeks around the definition of what fully vaccinated means, but the booster makes a material difference. If you get a booster, you are far less likely to end up in hospital because of Omicron. We still have just under 1,000 Victorians in hospital today. I'd much rather that we all went out and got our boosters done when we can, so we can keep getting those numbers down.
You talked about kind of the fact that there does seem to be a slowing of the tide with adults getting their booster shots. Does that worry you? I mean, that people seem to be kind of accepting their roles. Is it something that concerns you?
Yeah, look, it's not slowing down. So I mean, I think we've got 37%. We're sort of adding. No, we were sitting at 35% yesterday, so we've gone up 1.5%. I think in the last 24 hours or so, 1.3%, whatever the number is. But look, I agree, it's not a runaway train. So we are not seeing queues out of our vaccination centres. We're not seeing GPs being run over with demand for vaccination. So absolutely, I would like all of us with 2 million people now eligible, not yet having had their booster. Absolutely, I'd love them to come forward and to get that job done, recognising we've got another 2 million people behind them who will become eligible in the coming weeks. So there is absolutely a sense of urgency to making it happen. We've created the capacity to do it. The GPs and the pharmacists are doing a fantastic job. All of us need to kind of just take on that responsibility to get this job done.
Because obviously we're still at this point vaccinating those people who got vaccinated fairly early, so a lot of the people going through their booster now that that's kind of vulnerable or priority group. If you can't get them to go through quickly with that strong time, what hope is there for the wider population? Because a little bit, I suppose, more relaxed about having to get vaccinated.
Yeah, look, I mean, to a point. So I mean, I think we're now anybody who had their second dose before the end of October last year is now eligible for their booster dose. It's only a 3-month interval, so that includes a lot of people in their 30s and 40s, who are also now eligible and who are coming through. So I'm looking at those booster rates for even those younger cohorts, people in their 30s and 40s, are starting to increase. So yeah, we're seeing demand across those different age groups. I think generally speaking, look, January is always a slightly strange month. I think a lot of us don't want to be paying attention to normal news, let alone COVID news during that period of time, but we all want to be away enjoying life with our families. I think in fairness, if you look at the way that our community transmission numbers have been running through January, we're seeing people have taken actually quite a lot of care about changing their behaviours to do all those little things that have reduced the level of transmission. We've seen far more people, spending sociable time outside, having their family gatherings outside, and reducing some of those high transmission environments. So that's been a really positive move. I think now that the vast majority of people are kind of getting back into a normal rhythm of the kids are going back to school, we're all going back into work, now's a good time, if you haven't had that booster dose, to organise to get that booster dose done. If you want to go to your normal GP, that's fantastic. If you want to go to our state clinics, that's fine too. But so I'm not concerned. We're ready to do it. We've got capacity to do it. We're seeing healthy numbers coming through every day. Would I like to see more? Absolutely. Yep.
What's the government's message to the parents who are sending kids back on Monday?
Look, I don't, well, I mean, I'm here to respond on behalf of the COVID programme. I think what I would say is there is so much work that the whole education system's done, that our schools have done, that our teachers have done, that all that our education department have done to get schools ready to really ensure we can have a normal educational year. And I've gone through that whole list of measures already. I won't go through those again. There's all those measures are in place to protect, to minimise the risk of COVID transmission in those school environments. That's why we're doing twice weekly surveillance testing, again to minimise the number of kids who may turn positive, who are going into that school environment, to reduce those opportunities. So I think, look, we're all a little bit concerned as we step back into a world where we've got such high levels of COVID activity. We know that we're not seeing significantly high numbers of younger people going into hospital with the Omicron variant, but I would ask parents, again, do all those things with your child that you know are going to reduce risks. And if you've got concerns, speak to your school about the measures that they're taking to reassure you that school will be a safe environment for them. All good? All right. Thank you all. Thank you, guys. You too. Sure. 1.94. Yeah. Thanks for that. Good.